Hello and welcome to our channel. In this video we will discuss about hypertension, that is high blood pressure. So the topics that we will cover in this video are: what is high blood pressure? What causes high blood pressure? What are the symptoms of hypertension? And what is a consideration that what is considered high blood pressure? First is high blood pressure in adults, then stages of high blood pressure in adults, then high blood pressure in children, and then we will talk about high blood pressure in pregnant women. And what are the clinical features, that is signs and symptoms of high blood pressure, and lastly we will discuss about the complications of high blood pressure. So these are the main topics that we will cover in this video. So let's start. So first of all, we will talk about what is high blood pressure. So high blood pressure, or you can say hypertension, occurs when your blood pressure increases to unhealthy levels. When your blood pressure measurement takes into account how much blood is passing through your blood vessels and the amount of resistance the blood meets while the heart is pumping. And narrow arteries increases the resistance, and the narrower your arteries are, the higher your blood pressure will be. And over a long time, increased pressure can cause health issues including heart diseases. So this is the Now next we'll talk about what are the causes of high blood pressure. So basically there are two types of hypertension, that is primary hypertension and secondary hypertension. So each type has a different causes. First of all, we'll talk about the primary hypertension and what are its causes. So firstly, let's talk about what is primary hypertension and what type has a different cause. So primary hypertension is also called as essential hypertension. This kind of hypertension develops over time with no identical cause. Most people have this type of high blood pressure. Some researches are still unclear what mechanism causes blood pressure to slowly increases. And a combination of factors may play a very important role here, and these factors include: first, genes. Some people are generally predisposed to hypertension, and this may be from gene mutation or genetic abnormalities inherited from your parents. Second, physical. So if something in your body changes, you may begin experiencing issues throughout your body. High blood pressure may be one of those issues. For example, it is thought that changes in your kidney function due to aging may upset the body's natural balance of the salts and fluid. This change may cause your body's blood pressure to increase. Now, third factor is environment. So over time, unhealthy lifestyle choices like lack of physical activity and poor diet can take their role on your body. Lifestyle choices can lead to weight problems. Being overweight or obese can increase your risk of hypertension. So this was all about the primary hypertension causes. Now secondly, we'll talk about the secondary hypertension and its causes. So let's talk about. So secondary hypertension often occur quickly and can become more severe than primary hypertension. Several conditions that may cause secondary hypertension include kidney diseases, obstructive sleep apnea, third, congenital heart defects, next, fourth, problems with your thyroid, side effects of medications, use of illegal drugs, alcohol abuse or chronic use, next, adrenal gland problems, and the last one is certain endocrine tumors. So these are the basic leading factors that cause secondary hypertension, and it is very worse and very fatal than the primary hypertension. So this was all about the etiology of high blood pressure. Now next we'll talk about what are the clinical features That is, what are the signs and symptoms of hypertension? So let's talk about it. So hypertension is generally a silent condition. Many people won't experience any symptom, and it may take years or even decades for the condition to reach level severe enough that symptoms become obvious. Even then, these symptoms may be attributed to other issues. And some of the severe hypertension symptoms include headache, shortness of breath, nosebleeds, flushing, dizziness, chest pain, visual changes, and blood in the urine. These symptoms require immediate medical attention, and they don't occur in everyone with hypertension. But waiting for a symptom of this condition to appear could be fatal. The best way to know if you have hypertension is to get regular blood pressure readings. Most doctors' offices take a blood pressure reading at every appointment. And if you have an early physical, talk to your doctor about your risk for hypertension and other readings you may need to help you watch your blood pressure. For example, if you have a family history of heart diseases or have a risk factors of developing this condition, your doctor may recommend that you have your blood pressure checked twice a year. This helps you and your doctor stay on top of any possible issues before they become problematic. So, this was all about the clinical features of high blood pressure, or you can say hypertension. Now next we'll talk about what is considered high blood pressure. Okay, in different ages we'll talk about it. First we'll talk in adults, then we'll talk in pregnant women. Okay, like this way we'll talk about it. So let's talk about it. So blood pressure reading has two numbers. We all know that. The top one is your systolic number, that is the pressure in your blood vessel when your heart contracts. And the bottom one is your diastolic number, that indicates the pressure in your arteries when your heart relaxes between beats. The two numbers together shows whether your blood pressure is healthy or unhealthy. So a high systolic, that is 130 and over, or diastolic 80 and over, can count as high blood pressure, that is 130/80. But healthy numbers may also be different for adults, children, and pregnant women. Now we will talk about them. So high blood pressure in adult is a reading below 120 systolic and 80 diastolic blood pressure. And blood pressure between 120 to 129 systolic and under 80 diastolic is considered elevated, being high blood pressure later on. Your doctor may suggest eating less salt and eating a heart-healthy diet or living a more active lifestyle. Now we'll talk about the stages of hypertension for adults. So as you can see here on the screen, we have provided a chart. You can see here systolic pressure, diastolic pressure, and stages of hypertension. So let's talk about it. So if systolic pressure is 180 or over and diastolic pressure is 120 or over, so it is considered as a hypertensive crisis. And second condition, when the systolic pressure is over 140 and diastolic pressure is over 90, so it is considered as second stage of hypertension. And last one, if systolic pressure is 130 to 139 and diastolic pressure is 80 to 89, so it is considered as a first stage of hypertension. And this chart is only applicable in adults. Now next we'll talk about high blood pressure in children. So high blood pressure can also affect children from infants to teenagers. Unlike adults, there are specific healthy ranges for children based on their age, height, and gender. These ranges are established based on a healthy children's blood pressure readings. For example, here is a range of healthy blood pressure if your child is of average height 15th percentile for their age. So as you can see here, we have provided so you can see it. So let's talk about it now. So you can see here the age very clearly given here over your screen. Now next we'll talk about the high blood pressure in pregnant women. So high blood pressure can also occur during pregnancy, and reading higher than 140 systolic or 90 diastolic is considered high blood pressure. And normal blood pressure during pregnancy is less than 120 systolic and less than 80 diastolic. About 8% of women develop some form of hypertension while pregnancy. And there are two main categories of high blood pressure in pregnancy. First is chronic hypertension. This is when blood pressure is high before a woman becomes pregnant, or when high blood pressure develops before 20 weeks of pregnancy. And the second condition is hypertensive disorder of pregnancy. So these types of high blood pressure problems are specific to pregnant women and typically develop after 20th weeks of the pregnancy. And these types of problems typically disappear after a woman gives birth to a child. So this was all about the different high blood pressure ranges in child, in adult, in pregnant. So untreated and uncontrolled high blood pressure can damage your blood vessels and other organs, including your eyes, your kidneys, your heart, and your brain. And complications of hypertension in adults and children include heart attack, stroke, aneurysms, heart failure, kidney failure, loss of vision, difficulty thinking, or memory problems. And if you are pregnant, so high blood pressure complications may be preeclampsia, means high blood pressure and organ malfunctions of the kidney, lungs, liver, and brain. Secondly, eclampsia, that is high blood pressure, organ malfunction of the kidney, lungs, liver, brain, and seizures. Next, premature birth, LBW, that is low birth weight, and placental abruption, that is when placenta separates from the uterine wall before birth. So these are some complications which are. So that's all in this video. We have discussed about hypertension, that is also called as high blood pressure, and in this video we have discussed about what is high blood pressure, what are the various causes, what are the signs and symptoms, what are the various complications, and what are the different ranges of high blood pressure in different ages, whether they are adult, whether they are child, or whether they are pregnant, and whether they are in teen age. So that's all for today. See you guys in our next video. That is, how will you manage hypertension with natural remedies, with a natural treatment. So till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below. And yes, press the bell icon for more updates. Stay safe, stay healthy, and stay tension free. Meditate, exercise, and perform yogas, pranayams daily at least for 3 hours or thrice a day. And yes, thanks for watching our video.